Inside the Story with 60 Minutes producer Guy Campanile.
Our story this week is about the staff shortage at hospitals around the country during the pandemic. What I did was spent about 3.5 days with doctors, nurses, and technicians at the University of Louisville Hospital in Louisville, Kentucky. One of the techniques that we've used is embedding with healthcare providers during the pandemic. And what embedding means is spending time with them, not with a giant 60 Minutes crew and lots of people, but just yourself with a small camera and follow them around for a few days. It was a technique that 60 Minutes used often during the Iraq and Afghanistan conflicts to follow combat units. Well, we're doing the same thing with hospital workers. The advantage of it is that you get really close to what's happening without interfering with patient care or patient privacy. As I made my way around the hospital, folks were saying you should really go talk to Dr. Edward Miller. Miller is the Division Director of Maternal Fetal Medicine and High-Risk Obstetrics at the University of Louisville Health. And Dr. Miller began to describe how COVID was affecting the maternity ward.
While pregnancy doesn't make you more likely to get COVID, if you are pregnant and get COVID, you are more likely to have severe COVID. So not only are we seeing pregnant moms that come in with COVID infections, but we're seeing a higher incidence of them having really significant reactions to COVID, whether it be the need to be intubated, have supplemental oxygen, and in the hardest case situations, be delivered early.
What Dr. Miller shared was the extraordinary choices some of his patients face when they're infected with COVID late in their pregnancies.
There is nothing like telling a mom that we are going to put you to sleep, we are going to deliver your 26-week baby, and I don't know when you're going to wake up, if you're going to wake up, or if you're going to see your baby again. There's nothing like telling a dad that as well, and family members that as well. And then on the flip side, you have this voice in your head that says this was preventable, and this moment didn't have to happen like this.
One of the things that Dr. Miller described to me, which I found interesting, was what he described as a trust gap that he felt was developing between himself and some of his patients, and something he worried about that would outlast a pandemic. Often he's consulting with expectant moms about really important things about their health, and they'll take his advice, whether it's prenatal vitamins or things they should be doing very late in their pregnancies. But there are some patients who are not taking his advice at all on things like vaccines. And he thinks that's a huge issue.
I think that healthcare used to be the situation where you went to your doctor because they were the trusted person in your community, in your area, in your location, and you put this blind trust in them, which is one of the most humbling experiences of being a physician. That trust is held, however, COVID is testing it. I'm always amazed at how strong women are during pregnancy and how selfless they are during pregnancy. And the answer when you give a family a very difficult situation is almost always do what it takes to save the life of my child. But it's just interesting when that logic doesn't hold with this vaccine.
Being a high-risk obstetrician on a good day is a pretty stressful job. And for Dr. Miller, he's one of two in the whole hospital. So he is working all the time. Throw COVID on top of that, and now it's taken to a whole other level.
When COVID first came out, we were sharing PPE. We had no vaccine on the horizon. And now we have all these interventions. You can get tested for COVID at home. You can go on YouTube and see videos of what to do if you get COVID or vaccine information. And we've hit a point now where the majority of patients who are sickest that are coming in know about this information, and they know about these resources that are available to them. So this is our make or break moment. They are stretching us, they are challenging us, and we do not know how to reach them.
The maternity ward and neonatal intensive care unit at University of Louisville Hospital isn't much different than you'd find in most major hospitals around the country. You know, the nurses and doctors who work there are really special people. They're seeing some of the happiest events in people's lives and then some of the worst tragedies. Many of them have gotten ill, recovered, gone back to work, had family gotten ill, recovered, gone back to work, had family die from the disease. And it just keeps going and going and going, while some of their colleagues have left because of the relentless nature of the pandemic. The word we kept hearing over and over again was exhaustion. Exhaustion. These people are really tired.
The evolution of, going from seeing signs that say healthcare heroes and coming on the front lines of COVID and feeling like you were making a difference and like you're scared, but this is your calling, to now, where you're lying, you're trying to force something upon me, you're one of them. It's frustrating.